Hey there, Todd Cameron here, GP and co-founder at M3 Health. I want to chat to you about concession card billing today and some changes that we're proposing to make. You don't have to be an expert to look at this chart and realise that the federal governments, successive federal governments, not a political statement, have increased the amount that they fund to hospitals, and they've just basically invested no money into primary care. That has consequences. It has consequences for you because governments have ignored the importance of primary care. So what's happened is they've basically left the patient rebate for a consultation that goes up to 20 minutes at about $40 for around a decade, and that return for the amount of time and expertise invested by GPs that are specialist doctors is just not an appropriate return, and we can't provide good quality care at that rate. That left us with three choices. Basically, it meant that we either tried to offer medicine for 5 or 6 minutes, which is just ridiculous and could never be good, or we just said that we will not see any people that are bulk billed, and we decided there's probably an in-between. These are the three card types that are affected: pensioner concession cards, healthcare cards, Commonwealth seniors cards. All of these will now be paying the same price. The good news is we've had a really good chat. The GP team have had a good chat and decided that they can offer a discounted private rate to these people, and the doctors are taking a financial hit themselves to actually offer these services at a cheaper rate. There are three things that you can do to make this work well for you. The first thing is plan well. Make sure your visits go exactly to plan, that you write a list, that you have exactly what you want to talk about, and be aware that when you go beyond 15 to 20 minutes, it does go into the next price bracket, and so you need to make sure that you budget for the type of care that you need. The other thing is to make sure that you're using the item numbers that we continue to bulk bill, which are all around chronic disease management. If you have got chronic health conditions that require planning and prevention, then make sure you're using these item numbers as much as possible to reduce the impact on you in terms of your financial commitment. And the other thing to make sure of is that you are aware of the government Medicare safety net and that you use that appropriately. We'll put some different content out on that. Thank you for your time and attention. We look forward to serving you and making sure that you have access to 15 minutes of care with qualified, certified, vocationally registered specialist GPs who are the right people to look after you. Bye.